Assalamu alaikum wa rahmatullahi wa barakatuh. Today's lecture will continue the topic of tissue repair or healing. We said before that healing comes with regeneration or with scar formation, and we talked about regeneration in the last session. However, today's lecture is about scar formation. How does it come? Look, this is an injury. This is a wound in the epidermis and the skin. And this is the healing wound or the healed wound. Look, what is this type of tissue? What type is this tissue? It's paler, a little bit weaker. And of course, it's not bloody, it's not bleeding. This is scar. This is a scar formation. So this is a scar of the skin. It could also occur in the heart, like in myocardial infarction. Look, this is very good heart, normal, viable tissue. However, in that liver, in that heart, you can find this whitish area, which is not present here at all, not present here. So this whitish area actually is a healed myocardial infarction. It is a scar caused by healing of myocardial infarction. So scar is more whiter, and actually, because it's not formed of the original structure, original tissue structure, so it couldn't gain the original function. So it's weaker, it couldn't perform the original function of the tissue. But how scar is formed? Here, the scar, you can see it by your naked eye. I wonder now, what does it or look like under microscope? Well, look, this is the smooth muscle or the skeletal muscle. I think you saw it a lot in histology sessions. However, look at this. It's much paler. This is much paler tissue with less with less amount of muscles or even no muscle at all. So this is the fibrous tissue. This is the organizing granulation tissue, which comes eventually into scar tissue. Again, what is this? This is the skeletal muscle, and this is the fibrous tissue formed after healing of myocardial infarction. Well, let's talk about healing by connective tissue. It comes through two steps that coming after each other, which is formation of granulation tissue, and we will talk about the meaning of granulation tissue and how does it look. Well, then the granulation tissue eventually transforms into fibrous tissue. But how does it come? Well, let's imagine that this is the skin surface and there is a wound that is a little bit deeper. Here is the epidermis and here is the dermis, formed of fibroblast and blood vessels. Well, of course, this type of injury, make disruption of the extracellular matrix, as we said. And of course, there is an injury to the cell, the epithelial cells, as well as the mesenchymal cells. Epithelial cells, as well as the mesenchymal cells. Injury of mesenchymal cells give rise to what's called vascular epidermal growth factor. So, vascular epidermal growth factor will eventually lead the blood vessels, the already existing blood vessels and injured blood vessels, to be dilated. Only that? No. It also causes cause the release of nitric oxide. The release of nitric oxide. Nitric oxide. So vascular epidermal growth factor and nitric oxide leads to proliferation, leads to migration of these endothelial cells. These endothelial cells would be migrate under the effect of cytokines into the surrounding tissue. 1 minute. This is a blood vessel, and this is the endothelial cell begin to migrate. And while they migrate, they proliferate to form a new lumen. Is that right? However, this is not complete blood vessels. It needs a little bit remodeling. So after proliferation, we should say, stop endothelial cells, please. We want you to take the lumen caliper. We need to add for you basement membrane. And we need to add for you pericytes to make new lumen. Well, however, this new lumen is still permeable and cause leakage of fluid and blood. Why? Because tissue is in need actually for oxygen, needs for nutrients in order for the healing process to continue, need for inflammatory cells to phagocytose the bacteria, to phagocytose the necrotic tissue, to phagocytose the dead tissue whatsoever. They need the inflammatory cell. Need also antibodies to fix any bacteria present. All of these needs necessitate the formation of new vessels in the area of injury. So how does it come? Come through the process of new angiogenesis. Well, this is the first step in formation of the scar. This is the first step in healing by connective tissue laying down, is the formation of granulation tissue. And the basic component of granulation tissue is the blood vessels. And how does why we need blood vessels in the area of wound? We need it to supply us with oxygen, with nutrients, with inflammatory cells in order to phagocytose the dead tissue, to phagocytose the bacteria, to phagocytose the necrotic debris, and to fix the bacteria, for example, or the possible colonized organisms by specific antibodies. So we need many new vessels actually to be provided into the tissue at the site of healing or at the site of injury. And this comes through stimulation by the vascular epidermal growth factor that is released by many mesenchymal cells after injury, leading to increased vascular permeability, increased secretion of nitric oxide, and then the steps of angiogenesis is going on. What are the steps of angiogenesis? First of all, vasodilatation, as we said, release of nitric oxide, then migration of endothelial cells, and proliferation of the endothelial cells while migrate. Then after a while, we say stop proliferation, inhibition of endothelial cell proliferation to remodel it into a capillary with lumen, with basement membrane, and final step is recruitment of the peri-endothelial cells, So now I have many blood vessels here and here, over there, and so on in the tissue that could supply me and provide the tissue with the original and essential nutrients need in healing process. Well, so this is number one step, new angiogenesis. Do we need new angiogenesis in other tissue processes rather than healing? Yes. Do new angiogenesis is important elsewhere? Yes, we will discuss it later. However, the second step is fibroblast. Fibroblast. Proliferation, migration, and proliferation. Why we need fibroblast? Of course, this tissue couldn't be leaking forever. New vessels eventually will end. So we need to replace this with other type of tissue that is more tolerable and could sustain for a longer period, which is fibrous tissue. Fibrous tissue is deposited by fibroblast, so recall for fibroblast is essential. Other factors can recall for fibroblast, other like growth factors, including platelet-derived growth factors. So the blood here, the platelets derived by the blood here, or the platelets extravasated from the ruptured blood vessels release platelet-derived growth factors. And again, the mesenchymal cells, the fibroblast in the injured area, release fibroblast growth factor. All of these factors lead to more proliferation of fibroblast, What is the function of fibroblast? Let's see. So the sequential steps of connective tissue deposition is, first of all, the formation of new blood vessels, and this is a main component in the granulation tissue. And then migration and proliferation of fibroblasts. After fibroblasts come to the tissue, they deposited extracellular matrix and collagen to form scar formation. And after that, the extracellular matrix is remodeled in a step what's called maturation and reorganization, and we will talk about each step after a while. So this is the angiogenesis. This is the capillary sprouting, and the endothelial cell, look, it proliferate, migrate and proliferate, then stop migration and proliferation to be mature capillary network with full basement membrane and pericyte surrounding. Well, vasodilatation due to nitric oxide, separation of pericytes, proteolytic degradation of the vessel of basement membrane. Of course, we need the endothelial cells to migrate. How do they migrate? Within the presence of basement membrane and pericytes, we need to degrade the basement membrane. We need to separate the pericytes. So nitric oxide can act this role. Separation of pericytes, proteolytic degradation of the vessel basement membrane with formation of a capillary sprout. This is the capillary sprout. Subsequent vascular permeability, as we mentioned, due to vascular epidermal growth factor. Well, the second step after disruption of basement membrane and separation of pericytes with migration of endothelial cells. Yes, migration of endothelial cells toward the site of injury. Here is the site of injury and the cells are migrating in this direction. Then the cells proliferate while migrate. Then after a while there is inhibition of endothelial cell proliferation and remodeling into capillary tube or capillary network. Then maturation and differentiation into arterioles. Oh, even so, there is maturation of arterioles, venules, and capillaries. However, they are still leaky and they are still permeable due to the effect of vascular epidermal growth factor. This is the steps of angiogenesis. Look, the newly formed blood vessels are so leaky. The tissue here seems to ooze if we press on it. So the vessels are leaky due to incompletely formed interendothelial junctions and also due to vascular epidermal growth factor. When we put this photo under microscope, we see that there is many blood vessels, there is many edema. So granulation tissue is often edematous. And of course, we can explain now why edema persists after acute inflammatory response. Because the edema is a main constituent of granulation tissue. And why edema is a main constituent of granulation tissue? Because the blood vessels, the newly blood vessels or the newly formed blood vessels in granulation tissue is leaky. Why the newly formed blood vessels is leaky? Because there is incompletely formed interendothelial junction and due to the presence of vascular epidermal growth factor. So growth factors are important for angiogenesis. On top of them are the vascular endothelial growth factor and the basic fibroblast growth factor 2. We said that angiogenesis is not only critical in wound healing, but also it's critical in other situations. Like what? Like ischemic site. When we cut blood supply at an organ, say this is a leg, and then we cut the blood supply here. This is the blood vessels, and we cut the blood supply here. So all of this area is going to be ischemic. How the body could deal with this? Actually, through development of collaterals. Yes, collaterals comes here and then enter in a trial to supply the ischemic area. However, it may not succeed, but it's just a trial from the body to supply an ischemic area. And if the ischemic area is small, this could successfully be a good nourishment for the tissue. And if the ischemic area is large, it may be difficult to revitalize or resupply the whole tissue with the blood important for it. Well, again, angiogenesis is critical in tumors. And why not? Tumors, one of the criteria of tumors is that it proliferates and it metastasizes and it increases in the size in a horrible pattern. So it needs badly blood supply. It needs badly oxygen. It needs badly nutrients. It needs badly. So how could they bring their nutrients? Through the process of angiogenesis. Mechanism of angiogenesis. This occurs due to migration of endothelial precursor cells from the bone marrow or at the site of injury. So there is endothelial precursor cells that migrate from bone marrow in some situations and at the site of injury in other situations, like here in wound injury, where they differentiate and link the pre-existing blood vessels to form a network. So we said before that the blood vessels is disrupted and there is a sprout with migration of the endothelial cells. Here is another way of new angiogenesis, is that the bone marrow send, or the site of injury send endothelial precursors, small endothelial precursors that go to the site of injury and search for already existing blood vessels to attach to and to form new blood vessel. Look, there are two ways. Well, migration of fibroblasts. This is the second step we talked about. Fibroblasts undergo migration and proliferation into the site of injury. The process of recruitment and activation of fibroblasts to synthesize connective tissue protein are driven by many growth factors, including platelet-derived growth factor, fibroblast growth factor, and TGF-beta, transforming growth factor beta. And the growth factors here come from endothelial cells, inflammatory cells like macrophage, lymphocytes, and mast cells. So At the site of injury, as we told before, blood supply or provide tissue with inflammatory cells like macrophage, lymphocytes, and mast cells. These cells secrete or release these factors, platelet-driven growth factor and other fibroblast growth factors. And these factors lead to proliferation and migration of fibroblast. So fibroblast recruitment means fibroblast migration and activation at the site of injury occur through many growth factors. Where do these growth factors come from? They come from the injured endothelial cells or the present inflammatory cells at the site of injury. When they come, what are the functions of fibroblast? Yes, the fibroblast is the most common cell that creates collagen. And why we need collagen? Because we need to form scar, fibrous tissue. And why we need to form scar, fibrous tissue? As we told you before, that some permanent cells couldn't regenerate, so we have to replace it with other type of tissue. Extracellular matrix or basement membrane may be disrupted during injury due to severe injury or chronic injury. So again, we need to replace the cell, the type of tissue, with other type of tissue. And collagen, fibrous tissue, is the best type of tissue to replace the injured one. Yes, it's a little bit weaker, couldn't perform the original function of the cells. However, this is the best to replace the site of injury. Well, fibroblasts come and then they will deposit extracellular matrix to form scar. What is the scar? Scar is fibrous tissue deposition plus extracellular matrix deposition. So collagen synthesis in particular is critical to development of the strength in a healing wound site. We need strength in this site. Collagen in particular is important to provide strength in healing wound. Collagen synthesis by fibroblast begins early in wound healing, almost day 3 or to 5, and continues for several weeks. So the scar at the beginning actually is weaker than after 1 month or 2 months. Why? Because the collagen deposition is still little and it increases by time till it reaches a limit, or it reaches a critical point after which deposition of collagen should be stopped. Okay, collagen, that's enough. The wound is strengthened enough. So please, any more collagen will be deposited should be degraded. Then, collagen accumulation actually is balanced by increased synthesis and decreased degradation at a time, and then decreased synthesis with increased degradation. How the synthesis is decreased and degradation is increased after the fibroblast is decreased? Look, at first granulation tissue is full of blood vessels, newly formed blood vessels, and fibroblasts. But by time, with collagen deposition, the blood vessels will disappear. The newly formed blood vessels will disappear. And again, the fibroblast will disappear. So by time, the injured tissue will be formed mainly of fibrous tissue and collagen, and not cells. So scar actually is acellular tissue. Okay, and growth factors involved in deposition of extracellular matrix is platelet-derived growth factor, fibroblast growth factor, and again transforming growth factor beta. Look, this is granulation tissue, many blood vessels, loose edematous interstitium, and now the blood vessels a little bit well formed, a little bit decreased, not that dilated, and after a while the capillaries almost disappear, only two here. Fibroblasts almost disappear with formation of fibrous tissue and collagen more and more. Well, a young scar tissue, as we said, consists of granulation tissue, collagen fibers, and moderate amount of capillaries and fibroblasts. But as the scar matures, the amount of collagen increases and the scar becomes less cellular and avascular. That's called tissue remodeling. That's called tissue remodeling. So what is tissue remodeling? Tissue remodeling is come out from the balance between synthesis and degradation. Degradation occurs by matrix metalloproteinase, for example, collagenases. This is enzyme produced by fibroblast, macrophage, and neutrophil some epithelial cells to inhibit more transforming growth factor beta expression, so more fibrous deposition, or by steroids. Yes, steroids decrease collagen synthesis and hinder wound healing a little bit. So patients on steroids could suffer from bad wound healing. When you are asked to give a reason, you should say that steroids increase the degradation by certain enzymes, the degradation of collagen by certain enzymes, and hinder the full scar formation process. Well,